Nasopharyngeal carcinoma is one of the head and neck cancer that you do not require surgery. Primary treatment is concurrent chemoradiotherapy, but the treatment for other type of cancer in the head and neck region is usually surgery. Chemoradiotherapy is an addition depending on the staging and the tumor.
My menopause stage kind of started when I was like 50, 51 years old. I would have yeast infection in my vagina area. And somehow it would also manifest itself in my mouth, thrush, they call it thrush. And it would appear like little ulcers. By like 15th of June, I cannot tahan already because it kept growing. And we did the biopsy on the 17th of June. She rushed the results. The results came out like 4 or 5 days later on a Friday. And then, no, it's not ulcer, Siamy, it's cancer. Look at my husband, Xavier, look at me, okay? What's next? Well, you need to see a head and neck surgeon that specializes in this. About half an hour away, we got an appointment for later that afternoon. So we had a 2-hour lunch to like feel it. That was when the tears kind of came. Like, oh, okay, I have cancer.
The diagnosis itself, to a certain extent, was closer because I can see that she really needs more support now. I always believe the challenge is always in her head because whatever she needs medically is there. But how her body responds to that, it depends on how she feels about it, how her mindset about it.
We left the clinic and decided to come back to Malaysia and do. One of my acquaintances reached out to her, I showed her the pictures. She recommended Dr. Kong in Pantai. Flew back on the 24th, 25th in Dr. Kong's office. It was very detailed, very clear. Factually, this is what's going to happen. What next? PET scan and book a date, a week. Later, I was on the surgery table and had the surgery.
So from her case, we have decided that the best treatment is to do a surgery over the tongue to remove half of the tongue and also to operate on her neck. She is stage 3, and after the treatment, because it's considered as an advanced cancer, she requires chemo and radiotherapy. For a tongue cancer, because they tend to spread to the lymph node very easily. So as long as we have a tongue cancer, we will be operating on the neck prophylactically. If there is no lymph node in the neck, so the surgery towards the neck is smaller. So what is the idea is, one is we want to remove whatever microscopic spread of cancer to the lymph node in the neck, which might not be picked up from the scan. So when we remove the lymph node, we can send it to the lab and confirm whether it has spread to the lymph node or not. In her case is that from the scan, we noticed that it's already a suspicious lymph node, which we proceed with the surgery, and yes, it had confirmed that the suspicious lymph node is already a cancer spread. To remove the tongue is part of the treatment, but to many of them thought like the neck dissection or removal of the lymph node for the neck is not necessary, but it is always a standard treatment. It is to prevent the cancer from coming back and also to stage the patient properly, because sometimes microscopic spread to the lymph node is not picked up in the scan, but is found in the pathology. So the final diagnosis, the pathological staging is different from the radiological staging. How urgent is it to do a surgery is upon diagnosis, we try to operate as soon as possible because we do not want the tumor to spread further. So in Siamy case, we perform the surgery and we send the margin for a frozen section. This is to make sure that the margin or the area that we remove is clear from tumor.
We have a team that supports me. First it was Dr. Kong and then Dr. David, and we also even during the surgery, the 5 days I was here, there was a dietitian lady, Kuma, and she was very kind. She took really time to explain to me what to eat and what not to. So yeah, it's good. I highly recommend working with a dietitian. So far, the doctors that have seen me all make me feel very comfortable being in Pantai. The nurses at the HCU, ICU, very good, very attentive.
The message for the public is that if there is any ulcer in the tongue or in the mouth that lasts for more than 2 weeks and is painless, please see your doctor for a consultation and maybe a biopsy is required.
Don't wait. Be okay to ask for help. You can't always be strong. And it's okay. We will always be brave.
Down the road, we realized that we should find a purpose of this episode, why it happened to us. Define the purpose. How can we make something not so good become something better? She has cancer, but cancer doesn't have